Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina, and good afternoon, everyone. Since we were last here on Friday, we've had one more death in Nova Scotia at Northwood, and on behalf of all Nova Scotians, I want to extend our condolences and sympathies to the family of the loved one and let them know that they are in our thoughts and prayers. We know how difficult this is at any time to lose a loved one, but especially at COVID during this period of time with so many restrictions around how we mourn. And it just adds to the loss for a family. So we want you to know that we understand that, we feel that, and we are sending you our love and support and our condolences. Today we're reporting no new cases of COVID, and I want to thank everyone for helping us flatten the curve and remind everyone that we are still under an emergency order for at least another 2 weeks. Before I hand it over to Dr. Strang, I'd like to talk to you about daycare. Last week, Dr. Strang and his team advised me that the sector's reopening plan was not quite ready. More details were needed, and because this is about the safety of our children, we asked for your patience while the sector worked to finalize its plan with public health. And with Minister Churchill and his team at the Department of Education Early Childhood Development. Today, I'm happy to confirm the plan is ready. Licensed childcare centers and family daycare homes will open on June 15th. Licensed childcare centers will start at 50% capacity, and family daycare homes will be at full capacity. All types of facilities will be required to follow strict COVID-19 public health guidelines. Daycares will communicate directly with families in the coming days about their specific reopening plans. Government will provide PPE and hand sanitizer to licensed facilities for the next 6 months. We know some families won't be ready to send their children back to a licensed daycare center right away. We want to tell them that their spots will be held and that they won't be charged, and operators will continue to receive government funding until September to cover those unused spaces. I want to go back to something that I said last week. I was asked about child care for frontline workers. We looked into this, but we did not have many specific requests. I said the reason might have been because it took care of itself organically. Some of you had issues with that language. I'm sorry if I offended anyone. That wasn't my intention. Let me tell you what I meant. People stepped up and took care of children of frontline care workers. It happened naturally, and we are grateful for it. We want to thank them. Our daycares will open slowly, and if there are any public health or safety issues, we will immediately reassess. Dr. Strang.
Thank you very much, Premier. I too want to share condolences with the family of those mourning the passing of their loved one at Northwood over the weekend. This death was reported on Saturday, involved a resident at Northwood, and that brings the total number of deaths in Nova Scotia to 60. Today, it's good news again that we can report another day with no new COVID cases, so the total number of confirmed cases remains at 1,057. We remain having one long-term care facility with active cases. As everybody, I believe, knows, that is Northwood, who now only have 3 residents and 2 staff who are considered active cases. So those numbers continue to go down, which again is good news. The QE2 lab, we continue to have lots of capacity, and even though our numbers are typically very low on a Sunday, and into the Monday, we were actually tested 532 people yesterday. So our testing strategy of broad-based symptoms it continues to work. We're testing large numbers of people and having negative results. We have 5 individuals in hospital, 2 of those in the ICU. And 992 people can now be considered recovered. We've had 42,861 Nova Scotians who have been tested and have received negative results. And on the topic of negative results, the Nova Scotia Health Authority has announced today that they are now able to offer Nova Scotians the option to have negative test results for COVID-19 sent to them by email. This is for people who have a Nova Scotia health card. So when you go in for a test, you'll be given an option to agree if you want to have, if your test is negative, to have it sent to you by email. It is optional. So if you don't have an email address or aren't comfortable with this, sending your health information, you can still receive your negative results by phone. But if you do have an email, we would encourage you to take advantage of this so you will be able to get your test results more quickly. We still will be able to, if necessary, public health will still phone people with negative results if that is their desire. And we certainly will need to follow up everybody with a positive result. Needs to be followed up with a phone call from public health so we can start giving you advice about isolation and identifying your contacts and quarantining people as necessary. If you do get a call from public health, I've been asked to remind people that that if you have been tested, you need to check your voicemail regularly. The calls that will be displayed are from an unknown number, and many people tend to ignore those. So if you're waiting for a test result, please pay attention to your phone and your messages. The results are usually delivered within 48 to 72 hours. And while you are waiting for your test results, whether as you don't know what your result is, you could be positive. It's important that anybody who's been tested self-isolates while they're waiting for their test results. I know that many businesses and organizations are preparing to open on June the 5th or after that when they're ready. There's certainly a lot of questions in news stories and on social media to many government departments asking about what public health protocols are and what individual businesses need to follow. I see this as a good sign. It means that many Nova Scotian businesses and organizations are looking for information. They want to do the right thing. They want to ensure that whenever they choose to open, that they are doing it safely for their customers, for their staff, employees, volunteers, anybody who's in their business or other kind of operation. Let me just, to make sure people are clear, because we are getting a lot of questions, I just want to run through how, around planning and how people submit plans and who needs to submit a plan. If you're a business or organization that was ordered to be closed under the public health order, you must follow the plan developed by your sector association to reopen. We have been working with a number of sector and business associations approving those sector plans, which are then being communicated out, and individual operations then have to follow that sector plan. Even if you're not a current member of that association, you need to follow that plan, and those associations have said they are prepared to help people who are even in their sector but who may not currently be their members. This sector association plan, as I said, has been submitted, or there's a few that were waiting to be submitted. They ultimately have to be approved by both Occupational Health and Safety in the Department of Labor and Advanced Education and through my office for a public health approval. And those plans need to show how you're going to adhere to the basic public health protocols of physical distancing, sticking to the appropriate number of people if physical distancing cannot be adhered to, how to work and interact with customers in a safe manner, protocols around cleaning, handling and cleaning of equipment, how employees can be prepared to return to work, and basic communication with both employees and customers, and so everybody's aware of the details of the plan. Those are the high-level components of what a plan will be looking for with any sector plan that we're reviewing. For some sectors, such as restaurants and bars, there are additional requirements in the public health order, and we're working directly with those sectors so they're aware of those specific requirements. So if you are, for example, if you're a restaurant, you need to follow the Restaurant Association of Nova Scotia plan and apply that sector plan to the specifics of your own restaurant. If you own a hair salon, you need to follow the Cosmetology Association of Nova Scotia plan and apply it to your own salon operations. If your business was ordered by public health to close and you do not have a sector association, you're expected to develop your own plan and submit it to government for approval, and then you can submit it to Nova Scotia Economy or nseconomy@novascotia.ca, and that email is on our Reopen Nova Scotia website, and I'll give you that URL in a minute. As those plans are approved, we're asking people to post them on their own website, and we are then linking to those from the government website. It's an important way that we can demonstrate to the public about what the plans are, and they have confidence around safe reopening. For businesses who were not ordered by public health to close but may have closed for a number of reasons, you should have a written plan. It should follow the same protocols that I just listed for organizations that were closed. But you do not need to submit the plan. But having a written plan will help you think about the risks in your operation, put measures in place to address them, and will be something that you can use to communicate to your customers and clients that you are understanding their and respecting their safety, and the same for your employees. So there's more detailed information on this at the government website, and that's novascotia.ca/reopen Nova Scotia. And that website has a number of other tools and guidance information to help a range of businesses prepare to reopen. I know that some people are looking for a large, lengthy document that spells out in exact detail how to operate during a pandemic, and looking to government to provide that. But every business is different. Every business owner or organization knows their own environment best. So we have providing people the necessary public health protocols and guidance that need to be in place so they can operate safely, and then asking organizations and associations to develop plans with the knowledge that they have of the work that they do. And that's why I've been doing this consultation for the last several weeks, and we're having more discussions to clarify information in this week and next week. It's important that people understand the rules and the public health parameters with which they need to operate, but we also, as government, need to make sure that we give them the space to come up with a plan that works for them. And we're certainly encouraging people to think innovatively and creatively about how they could meet the necessary public health requirements. I'll end there, Premier, and hand it back to you.
Thank you, Dr. Strang. And before we go to questions, I want to take a moment to talk about the Take a Knee demonstration. Many of you did it at home, and some of you will gather this evening in your communities. But last night, more than 1,000 of you came together in Halifax to honor George Floyd and to express your anger and frustration that another black man has died at the hands of police. I was at home with my family in the Valley, but I was following online. And I want to say how I was so impressed at how you conducted yourself in the midst of all this pain. I was pleased to see most of you in masks. It would have been better if we'd been able to self-distance yourself, but you were respectful of one another, you were peaceful, and you made your point very clear. You are fed up, and so we all should be. We've had our own issues of systemic racism in this province. We have tried through the restorative process to help some families heal from past wrongs that took place decades ago. We are working with police forces to end street checks. We are supporting our African Nova Scotia communities to reclaim their land titles, deeds that were not entitled to them simply because they were black. We recognize we need to fight racism, discrimination, and inequalities that African Nova Scotians face every day. That's why we developed a plan called Count Us In to support the United Nations Decade of People of African Descent. We are trying, but we know we need to do more. Education, employment, and making sure African Nova Scotians see themselves reflected in our institutions. What happened to George Floyd should never have happened, and it should never happen to anyone again. This is a time in our history where we can't go back, but we have to move forward, and we have to do it together in a loving, caring, thoughtful, equal way. We are all in this together, and we need to hold hands and demonstrate to the world that we are in this together and that we respect each other for who we are as individuals and as a community. We'll take your questions now.
Again, just a reminder, we'll take one question and one follow-up from reporters on the phone in the allotted time that we have. We'll start with Alicia Drost from Global. Go ahead, Alicia.
thank you. A proposed class action lawsuit has been filed against Northwood in regards to what it says is the inadequate response to the COVID-19 pandemic. I'm just wondering what your response to this lawsuit is, and if there should have been more oversight or inspections at the facility to ensure that they were adhering to all infection control measures.
I haven't seen that. I heard there was a class action filed today. We'll follow through with it. I want to thank all those that work at Northwood for their continued care of the residents and our loved ones who are in that facility. And again, thank them for what they continue to do as we try to get that virus out of that facility.
Go ahead with your follow-up, Alicia.
Can you talk a little bit more in detail what steps were taken to ensure that long-term facilities like Northwood were taking all health measures seriously?
So we have a long-standing work with our long-term care facilities. Every winter we work with them specifically around how they respond to influenza and infection control around influenza. They also have general infection control guidance and how they deal with other outbreaks of which are not unusual of norovirus, other potential infectious agents. So we have a whole there's a very solid baseline from which we started, and then we use that to then develop a COVID-specific outbreak response protocol, which starts with early notification of any cases. And we identified very early on that even a single case of COVID-19 in a resident would constitute an outbreak and require reporting to public health. And as soon as that reporting happens, then public health moves in to support the facility on the implementation of the documented and infection control steps. All the things that were necessary to be in place for COVID in terms of cohorting individuals, separating cases from contacts, enhanced cleaning, a number of other pieces, they're all based on exactly what we do for influenza and other respiratory viruses. And from there, as we had our first long-term care outbreak, we realized right away that there were significant issues that could arise around staffing challenges, which are beyond just public health. So very quickly, with our very first outbreak, we developed a process that brought together colleagues in the continuing care sector, from the health authority, from the Department of Health and Wellness, to work together very closely with whatever facilities affected by an outbreak to manage any staffing issues that may arise from the need to isolate or quarantine any staff involved. So I feel we've had a very robust process in place, building on the long-standing work we've done with long-term care facilities in general around outbreak management.
Next, we'll go to Paul Leger, Radio-Canada. Go ahead, Paul.
Yes, hi. I have a colleague working on a tourism question, and a couple of questions for the Premier. What do you expect the tourism season will be like as the campings reopen? Are Nova Scotians going to be allowed to, and can they already travel completely within the province?
Well, there's an announcement that campgrounds are opening this weekend. Our provincial campgrounds will open the 15th of this month, and campers will be able to travel throughout the province, respecting the public health protocols that have been put in place, whether it is a private campground or our own government-owned campgrounds.
Go ahead with your follow-up, Paul.
Yeah, there's a lot of billions of dollars of visitors coming to the province every year. And as these people will not be able to be with us this summer, it looks like it, is there any form of aid that's going to be provided to tourism operators who so far have not been able to qualify for any provincial grants?
Well, as you know, the national government made a commitment through ACOA dealing with the issue of tourism, making money available for the tourism sector. There's no question we as a province rely heavily on this sector. It's a huge economic driver. We're looking at are there ways that we can provide a window for some of these businesses to be able to have a season. and we'll continue to work with them and our national partner on specifics when it comes to the tourism sector. But we're hopeful as we can, and there's been lots of discussion in Atlantic Canada about having an Atlantic bubble. What does that look like? Public health will be involved in that, whether it's possible or not, and we'll continue to look at all options that will help provide some support to that sector and those businesses.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Premier, you talked a bit off the top of the press conference about the protest last night. I know there was some concern about physical distancing. I'm wondering whether or not there's any public health concern, or does the right to protest trump public health directives for something like this?
Well, first of all, let me just say how peaceful and respectful people were last night, and clear in making their voices heard. I've said from the time I'm in Premier, I've stepped to microphones talking about the systemic racism that has been in our province, and how do we need to improve that within our own infrastructure and particularly our institutions. Every Nova Scotian needs to be able to see themselves reflected in our government and judiciary, in all aspects of our life. And we're working very hard at that. But when you watch what's happened to the south of the border, where Black American was killed at the hands of law enforcement, you understand the outrage and hurt and anger that people are feeling. It's not as this is the first time this has happened, and quite frankly, the political response in the United States has been offensive to the world. In my view, would we want people? Of course, we're concerned about people's health. This virus is deadly. What we would want them to do is to practice that distancing. If you're going to have a protest on the street, let's take over another street. Let's broaden it to a bigger space if we can try to do self-distancing. And again, I was pleased with people wearing masks, because this virus spreads quickly and is deadly.
Go ahead with your follow-up, Natasha.
Thank you. I know you mentioned some of the things you've already done to try to combat racism within Nova Scotia. I'm wondering if there's something you're looking at doing now, or if there's more you need to expand on in the province to help combat this really serious issue.
Well, the Count Us In program is a decade long. It's not a one-day event. It is a program that will take over the next 10 years. I was so pleased to have the United Nations come to Nova Scotia, the only place in North America where they came actually to an announcement around the work that we'd been doing in this province. But I don't want anyone to think that we have even come close to finishing our journey. We still have lots of work to do. We have a lot of trust to rebuild. Every child in this province, regardless of socioeconomic circumstances, regardless of the families they're born into, regardless of the color of their skin, regardless of where they came from, every child should be allowed to have the same aspirations, hopes, and dreams to have a full and productive life. Unfortunately, too many African Nova Scotia children have not seen that, and because of systemic racism. And we need to call it for what it is. I can't fix the sins of our past. I can tell you what I can do is change our future, and that's what I will continue to do as the Premier of this province, to ensure that everyone sees themselves reflected in this province.
Next, we'll go to Preston Mulligan from CBC. Go ahead, Preston.
Hi, thanks. Yeah, question for the Premier. Premier, given the reduced capacity daycares are going to have to operate under when they reopen on the 15th, what are we doing to make sure that the essential workers, healthcare workers, farmers, etc., have enough of them have spaces in those daycares?
Well, the spaces that we're putting in place obviously are following the public health protocols. We'll continue to ensure that people who had spaces, they'll be there for them at September. And as we said as well, there are also the private day homes that we're continuing, that will be working at full capacity. And we'll continue to work with individual sectors to provide support if required.
Go ahead, Preston, with your follow-up.
And you mentioned also, Premier, the idea of the maritime bubble. The Premier and PEI has been talking about it quite a bit. We've heard a bit from the Premier of New Brunswick. What do you say to them? What do you say to the two Premiers about your plans or Nova Scotia's potential participation in that bubble?
Well, we obviously we continue to work with public health. Our public health teams across the region will continue to having conversations to be monitoring what's happening in our respective provinces. What is the appropriate time to be able to move within the region? I think we're going to have conversations when that happens. What about the 14-day quarantine? What do we do with that? Right now, that's still in place. If you come into Nova Scotia, you have to self-isolate for 14 days, and vice versa. If someone goes into another province, the same thing. So those are ongoing conversations. We're open certainly to that idea of what we can do as a region. The ferry is actually opened, moving, I believe, the middle of this month between PEI and Nova Scotia for commercial traffic. What would that look like for passenger traffic, in the middle of June, 1st of July? And then obviously continue to work with New Brunswick, who obviously has had a situation in their province where someone went to a neighboring province and came home without that self-isolation. So I'm sure that through our continued conversations, they'll look at best practices, things they've learned from that, and how can we best do it. Because at some point, we're going to have to start allowing the mobility of our citizens for their health, quite frankly, and for reunifying families, and at the same time to build a bit of an economic plan for the tourism sector that would move beyond just Nova Scotia, but actually would include PEI, New Brunswick, and Newfoundland and Labrador.
Next, we'll go to Stuart Peddle from the Chronicle Herald. Go ahead, Stuart.
Hi, I'm wondering about where in the process we are as far as when the clock started ticking on our no cases recorded. Where we might be. I know there's been a couple of days where there's been 0. Also been a couple of days where there's been 1, and maybe even 2. Are we in that part where Dr. Strang has mentioned we need that 2 weeks, preferably 2 incubation cycles before we declare us through that part?
So we're in the middle. If you look at our epidemic curve for the last more than a week now, we've had little to no cases. And you're right, we had Friday, we had our first case was 0. Then we had a case on Saturday, 0 on Sunday, 1 yesterday, and again 0 today. So we're at a level that's continuing, and we're hoping to see that. Now, as we have to watch it extremely carefully as things start to reopen on June the 5th. So the month of June is going to be very important as we watch our epidemiology and see what happens with the number of cases that we start to see, and as we reopen, knowing that it takes at least a week, up to 2 weeks between exposure and showing symptoms. So we open up on June the 5th. It'll be a week after that we'll really be starting to watch and see what are we detecting. I've said from the very beginning that continuing to have strong surveillance, easy access to testing is going to be critically important to sustain in the weeks to months to come. As we move into this new normal, we have to continue to make sure we have a very strong ability to keep a very close eye on what's the level of activity of COVID-19 in our communities. We're not expecting to have 0. As we introduce more, we will likely get more cases. The question that I want to more interested in is, are we able to detect those cases early? Are we able to lock them down so that we prevent further spread? And do they stay as sporadic, isolated cases? That's our goal.
Go ahead with your follow-up.
Well, then, related to the protest of last night, are health authorities looking to perhaps contact or keep a track of some sort on who the people who may have been there, who may have been exposed in these cases? I imagine it is quite high on your priority list of being aware of possible exposure, and that these people may now require testing within the next 2 weeks.
So we're not aware of anybody. It'd be too early to tell. There's no way of knowing who was at that event. We'll certainly be watching, and one of the questions we'll be asking, as Public Health always does, when any case we identify, our key questions are in the period when they could have been infectious, able to spread to others. Where were they? What kind of activities are they doing? And the same thing around the period where the time period where we work backwards and say, when did you become ill? when was the time frame that you likely became exposed, and also asking them about the same questions where they could have likely become exposed. And if we see cases in the next week to 2 weeks, and we start to identify through that follow-up of individual cases that exposure at this rally was a common source, we'll take further actions if necessary in terms of notifying people and maybe doing broad testing. But it's premature to make that judgment now. The point is that we have to, even if we have very low levels, where what the Premier said, and I completely agree with, as people are coming together to rightfully and respectably protest, that's absolutely necessary and important, but we still need to understand following public health protocols around social distancing, masking, etc., are critically important as we allow people to necessarily get together.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. For the Premier, you've discussed the 10 days between when businesses can open and when daycares will be allowed to open. You've asked business owners on Friday to respect employees' childcare issues during this time. Can you clarify this? Are you asking for businesses to provide childcare, or that they be accommodating if staff cannot work due to childcare issues? And what about business owners dealing with unmet childcare needs themselves?
I would say all of the above. This is an unprecedented time. We're coming into where it's going to require all of us to support each other, whether it is actually coming back into the workforce or other aspects of our life. And I was calling upon all employers to understand in the 10 days between their opening and when the daycare centers in our province will open that employees, business owners will require support, whether it is for their own child care or the child care of their employees, or to your last point, if a business owner is requiring that child care, it will require all of us to provide some support to be able to ensure that people get a chance to go back to work, these businesses can open at the same time as we wait for our child care and daycare centers to meet the public health protocols. After all, we weren't going to open those based on the safety of our children. That's the most critical thing. And I, again, ask people to continue to support one another through that period.
Go ahead, Lindsay, with your follow-up.
Thank you. With the 50% reduction at daycare, will your government keep their funding at pre-COVID levels, recognizing that they have fixed costs that won't decrease with less children attending?
So what we said was that we would, for those unused spaces, we would continue to provide them support through to September.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, thank you. Premier, I understand that you've been asked several times about a potential provincial inquiry into the mass shootings, and I think I understand your position is that it's primarily federal issues. Leaving that aside, it's now been 15 months today since Glenn Assoon was exonerated for the false murder conviction that he had. There were a lot of issues related to that case directly involving the RCMP, but also Halifax Police. Is there some thought that you can give him some resolution? He's in ill health. He's had 4 heart attacks. He has underlying conditions. He's over 65 years old. He's a prime candidate for bad outcomes should he get COVID-19. I understand that monetary compensation is a separate issue, but can you give him some sort of, would you call an inquiry to find out why that injustice was done to him?
Well, 2 things. Go back to your original thing. I never said that the inquiry in the mass shooting here was all a federal responsibility. What I've said, it needed to be a joint inquiry. They need to be at the table. We need to be able to compel witnesses because when the recommendations come out, we need to be able to implement those recommendations. And some of them will have to be implemented by the national government. And if they're not at the table, very much like right now at the Desmond inquiry, they are not a participating partner. We are doing that inquiry on our own. And if there are recommendations that come forward that are towards the federal government, we have no capacity to enforce those recommendations. We want to make sure that the families in this mass shooting who deserve answers We want answers, but we want to make sure that when this inquiry is called, that the appropriate people are at the table to enforce the recommendations. That's the most critical part of this that is being lost in this debate. We have never said we don't want an inquiry. What we said is the federal government has to be at the table, because if there's recommendations towards the RCMP, we want them enforced. If there's recommendations around gun laws in this province, in this country, we want them enforced. And if there are recommendations for our province, we will enforce them. But we need them at the table, and it's time for them to get to the table. These families need a clear direction that Ottawa is going to sit down at the table with the province of Nova Scotia to have and come up with recommendations around that mass shooting. Your question around Mr. Assoon, I know that the Department of Justice is working with the national government. I believe there's been issues around compensation. There are other things working through with their lawyer, and that is ongoing.
Go ahead with your follow-up, Tim.
Yeah, I guess my question was, will you call an inquiry into the Glen Assoon wrongful conviction?
In fairness, Tim, I don't know where that is. I don't know what's happening with the Minister of Justice. That's a better question for him at this moment. I've been dealing with this, and quite frankly, he has been following that file and working with our national government, and my understanding, working with the legal team of Mr. Assoon.
Next, we'll go to Kyle Shaw from the Coast. Go ahead, Kyle.
Thanks, Tina. I appreciated the strong support I'm hearing today from both of you for the Take a Knee protesters in Halifax. But for Dr. Strang, I'd like to get a little bit more of the public health perspective. In particular, this morning on CBC Radio's show The Current, the Globe and Mail's health reporter Andre Picard said something very interesting, which I'll quote. He said, COVID-19 is not the only public health issue in the world. Racism is very much a public health issue, one that we should take seriously. So you can't just say to these protesters, go home, forget about this because there's a pandemic. This is as serious, if not more serious, an issue as COVID-19. Dr. Strang, your thoughts?
So there's multiple public health issues, absolutely racism, socioeconomic inequalities, on and on, that we continue to pay attention to in public health, and how we actually work with communities to bring forward information on those and how all those various things impact people's health. And I think what we're seeing is through COVID-19 is how actually it's highlighting some of these who's at greater impact from COVID-19, and then what we need to do moving forward to be as we live in an era of living with COVID-19, what it shows us about how we need to pay attention to systemic inequities, etc. So I don't think anybody in public health has ever said that we're only focusing on COVID-19. We necessarily had very focused attention for a period of time while we got a handle on COVID-19. Certainly now moving forward, we have to understand whether it's COVID-19, tuberculosis, a range of infectious diseases that have differing impacts depending on differing communities and different populations.
And nor did anyone tell them to go home. As a matter of fact, we support the right to protest, and quite frankly, we join them in this cause of systemic racism beyond our province. But we as a government are focused on it. But let me be clear in your question. You left with the idea that public health or government said for them just to go home. That's not. No one has ever said that. So I just want to be clear about that. Very proud of the work that has been happening in this province around racism, and very grateful for the demonstration that took place last night, in the way it was demonstrated, the way they demonstrated, and I know will happen across our province and other communities tonight.
Go ahead with your follow-up, Kyle.
Thanks. Later in that same interview, you can tell what I was listening to this morning, Andre Picard posed a question about racism, which I'd like to put to Dr. Strang now, again, as a matter of public health. And that question is, and talking about racism, he said, why haven't we tackled this with the same urgency and determination as we have COVID-19?
I mean, we have those are long-standing systemic issues. I could list you a list of a range of other issues that you could ask the same question about. Ultimately, people's health is very big and complex, and there's all sorts of societal issues that those are questions not for public health, but as a society, we ask that what do we place as most important, and what do we want governments to pay attention to?
Listen, as I said from the very beginning, governments need to acknowledge that racism, systemic racism, is rooted in our institutions. I've said it from the day I was Premier of the province. One of the most powerful experiences I'm involved in was the Home for Colored Children and the restorative inquiry that took place that was able to allow the beginning of the healing process to start. But the reason it was able to start, quite frankly, is because we acknowledged what had happened by our ancestors in this province. We have continued to be committed. It will require all of us, not just governments, not just public health. It will call every one of us to stand up and demonstrate a unified voice and a caring, compassionate society that we want to be when it comes to racism. The behavior of the past is unacceptable. We are a diverse population, and too many African Nova Scotians don't feel and see themselves reflected in this province, and it's unacceptable. I can't fix what our ancestor did, but I can tell you I can lead a government and lead a province that will continue to stay united with all Nova Scotians to ensure that everyone is treated equally and fairly and respected in this province. And we will continue to do that. Our history is not great, and we need to call it out, which we have, and we need to build on it and move towards the future.
That's all the time we have for questions today. Go ahead, Premier.
Thank you, Tina. This is the time of the briefing where I really recognize Nova Scotians and try to tell us all to be kind and considerate. But today I can only think of 3 words: Black Lives Matter.